What do you think are the most effective measures that can be taken to prevent mental health issues in young people?
Well, I think it's it's a very important question because the levels of mental health for children and young people are dire.
Yeah.
In Northern Ireland, they're the worst in the UK, and they're also worsening for certain age groups. I think that one of the first things is to take it seriously and for a joined up approach, and also to listen and believe young people and to collaborate with young people, because that's part of Article 24 of UNCRC. Every child has a right to the highest possible benefits of health, and that is mental health and physical health are intertwined. So it's really important to prioritise that, and for the services and for core funding to be available, particularly for early intervention. And but with that early intervention, there's a chance then, particularly at nursery or primary level, to work with the family as well as with the child and young person. And so I think that's a crucial aspect to get in early for prevention, so therefore to have a proactive approach rather than a reactive approach. Everybody has a right, an equal right to those services, and yet at the moment it's a bit patchy, and it's we are compromised by short-term funding, which means that even a service may grow up, but then the funding is changed and then it collapses again. So it's very hard to get a consistent approach over time. It's utilising the existing services that are there, but having a much more joined up approach so that CAMS and community services can work together. But we face a rising challenge, and the core issue is budget. But I think there should be ring-fenced budgeting for mental health because it's such a priority. And it is about the economic future. And that's a kind of a side effect. The most important thing is the well-being of an individual. But the community well-being is important too, to think of the economic future.